name is Nischal Sahai, and I'm the lead principal investigator at USC Clinical Trials in South Brisbane. I'm also a registered general practitioner. Medicine is actually my second career. I originally completed a Bachelor of Health Science from QUT in Brisbane, Queensland, majoring in Health Information Management. And then I worked in New South Wales and Queensland Health Departments in a health planning and policy role for about 10 years. During this time, I also completed a Masters of Marketing that I required for the work that I did at the time, and I did this through the University of Newcastle in New South Wales. I then decided to pursue my interest in becoming a doctor and completed my medical degree at the University of Wollongong, which is also based in New South Wales. During my final year at medical school, I was awarded the Academic Excellence in Research and Critical Analysis Award, which I suppose piqued my initial interest in research. And then after qualifying and working as a general practitioner for a while, I gradually transitioned to working as an investigator in clinical trials, and I'm now working across the South Brisbane and Moreton Bay regions in Brisbane, Queensland at the USC Clinical Trial Centres. The good thing about working in clinical trials is that our research areas cover a broad spectrum of investigational products, which can range from device trials to vaccine studies, and also therapeutics such as oral medications through to injectables and infusions. As a result, I have experience in phase 1 in human studies, which are first in human studies, through to phase 4 trials. The more recent research I have been involved in, given the pandemic situation, has included testing different COVID-19 vaccines for their safety, tolerability, and immunogenicity. Some of these studies have showed quite promising results, and that has been interesting to see. Similarly, this has now evolved into researching dual COVID-19 and influenza vaccine, which I think is, going forward, is the most logical next step. The other types of interventional trials that I have been involved in include conducting device studies such as vaccines which are delivered through a patch technology, Botox injectables, and various oral therapeutics, which span across a multitude of medical domains such as infectious diseases, cardiovascular disease, neurodevelopmental issues, and dermatological problems, to name a few. The reason I find working in clinical trials incredibly fulfilling is because this is real bench to bedside medicine. I'm fortunate to work in a role where I get to study how a drug or device in development is taken up by individuals who volunteer to be test subjects. It is exciting and informative as you follow a patient on the journey and assess the dynamics of an investigational product, whilst having an active role in medically managing them during the trial. It's also very humbling to know that you're part of a study which may ultimately translate into everyday clinical practice one day. At USC Clinical Trials, it is our aim to work in partnership with our local and global community to advance healthcare outcomes and ultimately improve access to cutting-edge medicines. And this is what drives the passion in my work. I enjoyed traveling before the pandemic, and I'm looking forward to planning trips with my family as restrictions ease. I also enjoy listening to music to unwind, and I'm trying to get back into playing squash when possible and when time permits.